Checking for cervical cancer. A cervical or pap smear is a test to check whether or not the cells of the cervix are healthy. Cells are removed and analyzed for either the presence of a virus, which can cause cancer, or for precancerous cells, which can be treated before they can develop into cancer. Why this test is important. A smear is a screening test to help prevent cancer. Cervical cancer is thought to be caused mainly by certain types of a sexually transmitted virus called human papillomavirus. Therefore, women who have ever had any kind of sexual contact, regardless of when it was, should have regular smears. This includes lesbians and trans men who still have a cervix. You should also have smears even if you have had the HPV vaccine. However, if you have never had any sexual contact, you may decide not to have this test. Globally, cervical cancer is the fourth most common cancer in women. A smear, also sometimes called a cervical screening test, requires cells to be taken from the cervix. The vagina is held open with a speculum while the sample is taken. Cells are then examined for abnormalities. Certain strains of HPV are thought to be the cause of nearly all cases of cervical cancer. Screening for the virus is becoming an important way to determine the initial risk of someone developing cervical cancer. If a cancer-causing strain of HPV is found in the smear test, the individual cells are examined under a microscope for abnormalities. This is called cytology. Initially, you will be asked some questions regarding your periods and sexual history, and you should be offered a chaperone. The test is very similar to having an internal pelvic examination. The cervix is seen using a speculum, which may be lubricated with a small amount of gel. Cells from the cervix are removed, usually with a small brush. The cells are sent to the lab in a small pot containing a special liquid. Having the test may be slightly uncomfortable, although it should not be painful. It will also help if you can relax. You should avoid having a smear during a period and should not have intercourse or use spermicidal cream or jelly for 24 hours beforehand. You should receive your results in 2 to 4 weeks. Most people will have a negative or normal result. A positive result may indicate either the presence of the HPV or abnormal cells seen on cytology. The nature of the cell changes found will determine whether you are followed up with another smear or referred for colposcopy to examine the cervix in more detail. A negative or normal test would not require any action. You should have another routine smear in 3 to 5 years. An inadequate result means there were not enough cells in the sample and the test needs to be repeated. It does not mean anything is wrong. A positive or abnormal result would mean cancer-causing strains of HPV were found to be present in the sample. The sample will then be checked for any abnormal cells, and further tests or treatment will depend on whether or not any abnormalities are found. Thank you for your attention.
Let's now go to pathology of chi mechanism. Let's discuss entering and exiting of chi in orifices. The entering and exiting of chi is very important for the health of the orifices and relevant sense organs. As we have seen above, the ascending and descending of chi is important for the health of the orifices, as the ascending of chi ensures that clear yang reaches the upper orifices. The entering and exiting of chi affects the orifices, and in particular, the sense organs, as it ensures that chi flows in and out of the sense organs, thus allowing proper sensations of sight, hearing, smell, and taste. In other words, the ascending of clear chi to the upper orifices is the necessary precondition for a proper functioning of the senses, but the proper entering and exiting of chi in and out of the orifices is the way in which the sense organs communicate with the external world in seeing, hearing, smelling, and tasting. In pathology, a disruption of the entering and exiting of qi in the orifices will affect the relevant sense organs Here, you can see the pathology of entering and exiting of qi in the orifices, the sign and symptoms. So for the eyes, uh, if it's an excessive exiting, there will be red. It will be red and painful. If excessive entering, there's blurred vision. For the ears, in excessive, there's ear discharge and pain. For the excessive entering, there's tinnitus. For the nose, for the excessive exiting, there's a nasal discharge and a blocked nose. For excessive entering, there's runny nose with profuse watery discharge. For the mouth, for the excessive exiting, the sticky taste, and excessive entering, this lack of taste sensation. To summarize, the entering and exiting of qi in the orifices ensures health of sense organs. The disruption of the entering and exiting of qi in the orifices will diminish acuity of sense organs. Thank you for your attention.
Okay.
We start with the foot tie-in spleen meridian, and we discuss spleen 1 in pi, retired white. Located on the medial side of the base of the nail of the great toe, the width of a Chinese leaf from the corner of the nail, approximately 0.1 sun. In pi is also known as retired white, hidden white, in white, ghost pile, ghost eye, hidden clarity. It is a wood point, Jingwell point, entry point, one of the 13 ghost points of Sun Si Miao. The spleen meridian begins its journey of transforming and transporting, renewing the body, mind, and spirit at the big toe. The spleen commands the ascending of qi, and it is helped here by being a wood point. The upward and outward movement of the wood impulse assists the spleen, not just in its distribution of juices and essences throughout the body and tongue, but also at the level of the mind, though is thought is intimately connected with the spleen, and the penetrative ability of wood helps it avoid stagnation, able to think clear, long thoughts. The spleen is connected with our center, the representation within the body, mind, and spirit of the place of humanity in the exchanges between heaven and earth. Lar and Rocha, Survey of Chinese Medicine 1986, say we return to the central place to which the whole circulatory dynamics of man and the cosmos returns to rediscover its resources. The spleen is the agent of transformation, not only through its transporting capacity, but because it gives shape to form, whether our flesh, blood, or our thoughts. Operating at its best, the spleen allows thought to return to our center to consider a situation from all sides, so we choose the most appropriate response, and it also enables our consciousness of possibilities, helping us to embody our higher purpose and yield a great harvest. In pi can help if preoccupation, obsessive rumination, or depression has led to blood stagnation, or if blood stagnation has led to anxiety and restlessness. This point calms the mind and stops excessive dreaming. It brings clarity of thought where there is congestion or mental agitation. Overthinking being both a causation as well as a pathology of the spleen by its powerful, invigorating wood and Jingwell nature. It encourages the upholding nature of the spleen, facilitating the flow of blood and qi as it starts its journey to the lung, the hand tai yin. It links earth to heaven. Use with direct moxa to stop bleeding from any part of the body, nose, stomach, bladder, intestines, and particularly the uterus. It stops bleeding by strengthening the spleen's function of holding the blood. Hidden white refers to the idea that Earth creates metal, and here is a reminder of the metal element. White refers to metal and reminds one of the connection between spleen and lung as yin. Hidden white may also refer to the flesh, where the point is located by the nail. The flourishing of the spleen and the essences is at the four whites, the corners of the lips. The spleen has mastery over the mouth. Ghost pile or ghost eyes is indicated for use when a person dreams with the sensation of weight pressing on the body. Also used with lung 11. Together, they are called kuilin, ghost eyes, where the patient stares vacantly into space, Three small boxes are burnt on the points, alternating between spleen 1 and LI11. Jigwell points can disperse excess qi that is swelling in the channel. They can be drained to release heat and interior wind in cases of mania, convulsions, and can relieve fullness below the heart. This is taken to mean internal blockage in the body, as these points, while being the most distal, also have a deep well-like reach to the organs. Spleen 1 is said to regulate overweight and overeating, especially when caused by depression or worry. When dispersed, it is said to reduce the craving for sweet food. The effect of food on earth, sour flavors will often dispel the urge for something sweet, just as the upward surge of qi in a new beginning can break through rumination. It is tonified where there is lack of appetite from splenic deficiency and stagnation. Tonifies the spleen, regulates blood, especially in cases of blood stasis in the uterus. Calms the mind. Indications of spleen 1. Depression, melancholia, stagnation of mind and spirit. Prolonged menstruation from spleen chi deficiency. Insomnia from blood deficiency. Bleeding from the spleen not containing the blood. Abdominal distension, nausea, mania and hysteria from heat and interior wind. So spleen 1 is wound point, entry point, Jingwell, antique winter point, a ghost point. This wound point helps to stimulate the spleen chi if there are signs of stagnation or clogging up, such as paralysis, obsessive or stuck thinking, overweight, and overeating, especially when worry and depression dominate. For menstrual disorders, particularly if prolonged, a spleen holds the blood, one can use direct moxa here to strengthen this action, brings clarity of thought, and helps focus and concentration, wound penetrating earth, calms the mind and eases mania or excessive dreaming. White probably indicates the spleen's mother connection to the sun metal, the lungs. Indications of potential point combinations. For bleeding disorders, hematemesis, epistaxis, hematuria, hematochezia, menorrhagia, we combine spleen 1 with spleen 10 and GV20. For fever and seizures, we combine spleen 1 with liver 2, stomach 36. Evidence-based applications. Acupuncture at lung 9, stomach 36, stomach 40, spleen 1, SI3, bladder 15, liver 3, CV12, and CV14 induced long-lasting reductions in attacks of primary Raynaud syndrome. Demonstrated effectiveness comparable to difenadine and did so without adverse effects. 15 minutes of electroacupuncture stimulation applied to spleen 1 and liver 1 appeared to constitute the optimal setting for treating acute pain in the pelvic limbs. Thank you for your attention.
Let's now go to pancreas. Let's discuss treating poor pancreas function. Once diagnosed, an acupuncture point will be selected to strengthen the pancreas function. Some typical acupoints are stomach 36 on the shin about 3 inches below the knee, pancreas 6 about 3 inches above the inner ankle, pancreas 3 on the side of the foot beside the big toe, and bladder 20 on the back. Note that usually only one single acupoint will be used. But in acupuncture, there is often a choice of several different acupoints that could be achieved the same effect. And the most appropriate one would be chosen depending on the circumstances. The above are the most commonly used acupoints to correct poor pancreas function. When poor pancreas function has been present for some time, these acupoints tend to feel tender when pressed due to the resonance between the pancreas and these acupoints. When one of the acupoints is stimulated, this utilizes this same resonance but in reverse, which encourages the organ to cancel out the malfunction in itself that caused the tenderness, and the organ returns to normal function. The pancreas pulse will then become much stronger where it was previously weak, and usually change in quality. The progress of treatment. In Western countries, acupuncture sessions tend to be given at weekly intervals initially. Then the time between treatments is increased as the signs and symptoms improve. On the second visit, most patients report an improvement in some of their symptoms, which could include an improvement in their sense of taste, energy or digestion, with less bloating and tiredness after eating or the absence of loose stools, and some even report an improvement in their ability to think, with their mind seeming more clear. After the first session, this improvement may only last for a day or two, particularly when the symptoms were present for many years. But after each successive treatment, the improvements usually last longer until the patient remains symptom free between treatments. We have here a sample patient, male aged 56. This patient had a wide range of symptoms which had built up for years, including poor appetite, feeling tired after eating, having a poor sense of taste, sweet cravings, loose stools, and he found it hard to drink after midday. All these symptoms cleared after a few treatments. The value of regular maintenance treatments. Once a patient's health problem has been resolved, they usually appreciate the value of good health and realize that this can be maintained by regular treatments, with the frequency being determined by the degree of stress in their life. In the Neijing, it is said when treatment is sought only after a disease has become fully developed, this is as if a well were dug when one is thirsty and as if weapons were cast when the fight is on. Would this not be too late? Thank you for your attention.
Let's discuss diagnosis by visceral organs. We continue with liver illnesses. Liver wind stirring in interior. The generation of internal wind is related to imbalance of yin yang in the tongue organs and is especially intimately linked to abnormalities of the liver. The principal symptoms are dizziness, tetany, or convulsion. Clinically, there are four main patterns: liver yang transforming into wind, extreme heat generating wind, yin deficiency giving rise to wind, and blood insufficiency generating wind. Liver yang transforms into wind, usually when liver and kidney yin have been chronically deficient, so that liver yang is unrestrained and induces liver wind. Extreme heat generates wind usually when exogenous heat is extreme and burns the liver meridians. Indeficiency gives rise to wind, usually during late stages of exogenous heat illnesses. In these stages, fluids have been severely damaged and the tendons and channels have lost nourishment. Wind arises in blood insufficiency, whether massive blood loss or prolonged decline in chronic illness, usually because blood can no longer nourish the tendons. Clinical manifestations. Liver yang transforming into wind. The main symptoms are dizziness, heaviness in the head, and lightness in the feet, headache on shaking the head, stiff neck and numb limbs, tremors in the hands and feet, and stammering speech. The tongue is red and the pulse taut and thread-like. Alternately, the patient faints suddenly with tetany or convulsion of the hands and feet. Or there are wry mouth and eye deviation and hemiplegia. Extreme heat generating wind, the main symptoms are high fever, dull sensorium, tetany or convulsion with opisthotonus when severe. Rolling up of the eyes and clenched jaw. The tongue is red or crimson with yellow coating. The pulse is taut and rapid. Wind arising in yin deficiency, the main symptoms are tremors of the hands and feet, accompanied by symptoms of liver insufficiency. Wind arising in blood insufficiency. The main symptoms are numbness of the body and limbs, spastic flexion of the joints, tremors of the hands and feet, and symptoms of liver blood insufficiency. Cold congealing liver meridians. This condition is mainly due to invasion by exogenous cold. When the cold evil congeals the liver meridians, Yang qi is thwarted. The tendons go into spasm, and the movement of qi and blood becomes impeded. The typical syndrome includes cold pain in the lower abdomen, radiating into the pudenda, or painful contraction of the scrota, worsened by cold and alleviated by warmth. The tongue coating is white and smooth, and the pulse deep and taut or slow. Dampness heat in liver meridians. The syndromes of dampness heat in the liver meridians are due to impairment of the dispersion function of the liver caused by dampness and heat gelling in the liver and gallbladder. This condition mainly arises from attack by exogenous dampness and heat from overindulgence in greasy and sweet foods or from disharmony between the spleen and the stomach with rise to endogenous dampness and heat. Gelling of dampness and heat in the liver meridian compromises the dispersion function of the liver and the gallbladder and the ascending and descending functions of the spleen and the stomach. These in turn compromise the digestion of foods and the distribution of essential nutrients. Clinically, this is also known as the syndrome of dampness heat in the liver and the gallbladder. There are several patterns of symptoms. In some patients, there are distending pain in the flanks, anorexia, abdominal distension, a bitter taste, and nausea as though about to vomit. In others, there is jaundice. In yet others, there are alternating chills and fever. In males, there may be burning pain and swelling of the testes. In females, there may be yellow, malodorous, vaginal discharge with vulvar itch. In all these patterns, the tongue is red with yellow greasy coating. Pulse is taut and rapid. Thank you for your attention.
Let's now go to advanced assessment of mental health disorders. Let's discuss mental status examination part 2. Here we have action and rationale. Third, assess mood and affect. These subjective parameters are frequently considered at the same time, but they differ in some respects. Mood is what feeling is conveyed, and affect is how the mood is conveyed. Ask about the patient's spirit to help define the mood of the patient. It may also help to ask patient significant others about the prevailing mood. Mood consists of a sustained feeling expressed by the patient, which includes impressions such as sad, euphoric, depressed, and angry. For example, a patient with bipolar disorder may feel euphoric during mania. Next, note effect, the observable prevailing emotional tone or expression of mood in voice, facial expression, and demeanor. Affect may be described with terms such as flat, inappropriate, laughing about a sad event, and labile, rapid shift from one extreme to another, like euphoric to irritable. Patient, Patients with depression may display a flat effect. Schizophrenia may present with inappropriate affect. Dementia may present with a labile effect. Fourth, evaluate speech patterns, assess the quantity, content, and speed. Note unusual words or characteristics, patterns the person uses, such as ending every response with, "That's just the way it is." Patterns may be described as rambling, pressured, slow, fast, loud, garbled, and well articulated. Mutism occurs when the patient does not speak but appears to follow the discussion. Blocking occurs when a patient abruptly stops talking for no obvious cause. Some patients may make up a word that has special meaning to them, but which is not known to anyone else, called a neologism. In schizophrenia, the patient may speak a lot but convey little information. Speech may be disorganized. Patients with delirium may have slurred speech. With progressive dementia, patients may present with aphasia and confabulation. Fifth, assess motor behavior. Note pacing, hyperactivity, retarded movement, little movement or underactivity, rigidity, little spontaneous movement, hand wringing, picking at clothes, abnormal startle reflex, tics, and tremors. Dementia may present with rigidity. Depression may present with psychomotor retardation or agitation. Patients with anxiety may be restless and wring their hand, pace, and fidget. 6. Evaluate judgment and insight. A judgment and insight are closely related terms. Judgment involves the ability to make decisions appropriate to a particular situation after comparing and evaluating the alternatives. When assessing judgment, evaluate the ability of the patient to meet family and social obligations, how realistic the patient's plans for the future are, and patient's ability to solve hypothetical problems. Abnormal findings for judgment include impulsive, indecisive, and lacking in reality testing. That is, ability to distinguish and validate what is from what is not based in reality. Patients with dementia may demonstrate deteriorated and impulsive judgment. During a manic episode, a patient with bipolar disorder may also demonstrate impulsive judgment. Patients with depression and anxiety disorders may be indecisive. Assess insight. Insight, in contrast, involves the ability to connect problems with personal behaviors, learn from mistakes, and understand consequences of behaviors and illness. Patients with little insight often fail, for example, to comply with proper instructions to take their medications. It may be difficult for them to understand that taking medications such as psychotropic drugs can prevent psychotic symptoms from reemerging. Seventh, evaluate thought patterns. This area assesses how the patient thinks relative to logic and coherence, and to the content or what the patient thinks about. Note how the patient's thoughts or responses relate to your conversation. Thought may be described with terms such as negative, delusional, fixed false belief, persecution, grandiosity, ideas of reference, and somatic. Other thought descriptors include racing, paranoid, or suspicious, loose associations, flight of ideas, circumstantial, delayed in reaching point because of unnecessary detail, perseverance, persistence, repetition of words or ideas, thought, broadcasting, and obsessions. Patients with bipolar disorder may experience grandiose and racing thought patterns. Schizophrenia often presents with delusional and paranoid thoughts. Patients with obsessive compulsive disorder may experience persevering and obsessing thought patterns. Thank you for your attention.
Acupuncture for emergencies, acute knee pain. Acute knee pain can arise from various causes, including injuries, medical conditions, or overuse. Identifying the underlying issue is crucial for effective treatment. Common causes. For injuries, we have sprains, strains, fractures, or ligament tears. For example, ACL injury. Medical conditions, arthritis, osteoarthritis, rheumatoid arthritis, bursitis, tendinitis. Overuse, repetitive activities or excessive physical exertion. Symptoms, sudden onset of pain, swelling or inflammation, stiffness or reduced range of motion, bruising or redness. Initial management, rest, avoid activities that exacerbate pain. Ice, apply ice packs to reduce swelling. Compression, use a bandage to support the knee. Elevation, keep the knee elevated to minimize swelling. Use bladder 11 and LI 11, pericardium 6 and liver 8. Use acupuncture on the inner Qian and outer Qian points. Use Bingku, stomach 34, needle toward the feet. Spleen, needle toward the feet and stomach 35. Use Lingku, Tapai, and Jianchong points. Needle toward the knee for the Jianchong point. Use LI 11, LAM 5, SI 8, and SJ 10. Use Quanku and Shiquan points, one sewn back from the spleen line, and use tender spot on the lower abdomen, mostly on the sick knee side. Use Shiquan, bladder 40 and stomach 36. Do point pressing on the Shalku Kong point with a bead. Put a bead on the medical tape, stick the tape on the acupuncture point with the bead toward the point, and press the bead from time to time. The point is located on the back of the small finger, the middle of the joint between the base stem and the middle stem of the small finger. Use bleeding and cupping therapy on bladder 43 on the back. Use bleeding and cupping therapy on the painful spots or the spots with clear veins on the knee. Use bleeding and cupping therapy on bladder 40 of the sick knee. Use fog therapy. Add 3 grams cinnamon and 9 grams fresh ginger to water. Bring to a boil for 30 minutes. Drink the extract. Thank you for your attention.
Let's now go to goiter under thyroid problems. Let's discuss etiology. Asian Chinese disease symptoms are not diseases in a Western sense, but clinical signs or symptoms. For example, goiter is not a disease in a Western sense, but simply a clinical sign. Hypo or hyperthyroidism, by contrast, are diseases in a Western sense. Nevertheless, goiter is a disease in the context of Chinese medicine. In Chinese, goiter is called ing. Ancient books mention Shi ing, or stone goiter, Lao ing, exhaustion goiter, Tu ing, earth goiter, Yu ing, worry goiter, and Qi ing, Qi goiter. Ancient Chinese doctors were aware that seaweeds can help goiter even though they did not know what about the role of iodine in the physiology of the thyroid. Etiology, emotional stress. Anger, worry, and pensiveness may all lead to qi stagnation after a period of time. This may affect not only the liver, which loses its free flow of qi, but also the lungs, whose qi fails to descend and stagnates in the chest and throat, the stomach, whose qi fails to descend, the heart, whose qi fails to descend, affecting the throat, and the spleen, whose qi fails to ascend, giving rise to phlegm. Qi stagnation in various organs affects the proper functioning of the qi mechanism, and this disrupts the proper movement of qi in the right direction. That therefore also affects the movement and transformation of fluids, which eventually leads to phlegm. Qi stagnation and phlegm interact, and both focus on the front of the throat where the liver, lung, and heart channels flow. This type of phlegm is called qi phlegm and is the most non-substantial type of phlegm. This type of goiter lump, especially in the beginning stages when there is only qi stagnation, will go up and down in size. After a prolonged time, qi stagnation may lead to blood stasis, which in itself interacts with phlegm. In such cases, the goiter lump will be hard, not going up and down in size, and probably painful. Please note that qi stagnation deriving from emotional stress does not affect only the liver but also the lungs, heart, stomach, and spleen. Qi stagnation of all these organs play a role in the pathology of goiter. Diet. Irregular eating and excessive consumption of greasy foods and dairy foods weaken the spleen and stomach, which cannot transform and transport food essences. Dampness is formed, later leading to phlegm. Irregular diet also disrupts the qi mechanism, leads to qi stagnation, and eventually blood stasis, which contribute to the formation of goiter. Environment. People who live in high mountainous regions lack iodine in water, and this may contribute to goiter. Although they did not know about the role of iodine in thyroid disorders, The ancient Chinese doctors did observe the higher incidence of goiter in people living in high mountains, but attributed that to factors other than iodine. Some ancient books talked about a cold poison in the water in high mountains in the northwest of China. As indicated above, other doctors mentioned the presence of sand in the water, yet others mentioned black earth and spring water as environmental causes of goiter. Interestingly, although the ancient Chinese doctors did not know about the role of iodine or the lack of it in the pathology of goiter, they did observe the beneficial effect of seaweed on goiter. Constitution. Women are more prone to goiter. This is because of the relationship between the liver channel on both goiter and menstruation. Because of menstruation, pregnancy and lactation, the liver channel is much more prone to qi and or blood stagnation in women, and this causes a high incidence of goiter in them. Excessive blood loss after childbirth or too many children too close together may also lead to depletion of liver and kidneys in women and predispose them to goiter. Another reason why women are more prone to goiter lies in the relationship between the uterus and the directing and penetrating vessels, the renmai and the changmai. The directing vessel flows through the uterus, deeply influencing menstruation, conception, and pregnancy, and up to the throat where goiter forms. Many cases of goiter in women are the result of a pathology of these two vessels in the uterus, which is transmitted upwards through the throat via the directing vessel. That explains why women with goiter outnumber men by 8 to 1. Thank you for your attention.